morning and welcome to your manual handling training. I'm Jenny Murphy, the manual handling trainer for SASH, and today we're going to talk about pat sliding. This is the pat slide that we use at SASH. As you can see, it's got a number of handholds on it and it's also got a low friction covering. I say a low friction covering, however this is very thin and doesn't last, so you must always use a slide sheet when you're pat sliding your patients. The other side of the pat slide you'll see have these slightly abrasive strips on, and they are to stop it moving around on the bed when you're using it. Quite often you'll be asked by people, what is the safe working load of a pat slide? And the short answer is, we don't need to know the safe working load of the pat slide because it's not considered to be weight bearing or for carrying patients. All it's doing is it's bridging a gap between one medium, such as this ED trolley, and the bed. So we're just facilitating a move across it rather than actually carrying or weight bearing our patient on it. Okay, so when we start doing our pat sliding, it's really important that you've got the right number of people. If you're talking about in intensive care or something like that, you will have somebody who's going to supervise the airway and also take care of any of the lines that are up the head end of the patient. However, if you're in a ward and you've suitably risk assessed this, then you can do this manoeuvre with 4 members of staff, and that's what we're going to do today. So firstly, what we need to do is to ensure that the bed or the trolley is at the correct height for us, and we're then going to effect a roll of our patient onto his side so that we can put the pat slide in. Make sure obviously that your brakes are on the trolley so the trolley isn't going to move when you do this. Again, we're not going to assume that our patient can't do anything, but having asked Mr. Hoff, he's not able to help us roll onto his side, so we're going to effect that for him. We're going to bend the knee and put the patient's foot flat on the bed again to avoid that friction. We're going to ask him to look in the direction that he's rolling and move the hand in the direction that he's rolling a little bit away from the body so that he doesn't roll on it, and then get him to put his hand across his chest. Both of the members of staff involved in the roll will effect a step stance position with one foot in front of the other. And then Louisa, if you could reach across to the shoulder and the back of the hips, I will do the same, and we'll go on the command ready, steady, roll. So, ready, steady, roll. We've now got the patient in a sideline position, and Louise is going to help hold him in that. We now bring in our pat slide. And what we want to do is we want to make sure that the pat slide is the entire length of the patient, and roughly between 1/3 and 1/2 of the pat slide is on the bed that the patient is on at the moment. Then we get our slide sheet and we open it out so that it lays on top of the pat slide. Now we bring in the second bed. And it's important when we're bringing the bed in that we have the bed at the correct distance so that there's plenty of room for the patient to come sideways on here. We make sure that the receiving bed has a slight lowering to it compared to the bed that the patient is already on, and that's so that gravity will help us to effect that sideways transfer. And then the members of staff will roll Mr. Hoff back onto his back. Ready, steady, roll. So the members of staff at this side are going to pull out some of the red slide sheet towards them and lift the top portion of it and put their hands on the patient at that side. They will be in a step stance, and what they're going to do is on the command ready, steady, go, they're going to weight transfer forward and push the patient away from them. Members of staff on this side will lean forward and will take hold of the top slide sheet. Make sure you don't get into position too early, otherwise you're going to compromise your posture. Okay, does everybody know what they're doing? So we're going to weight transfer backwards and bring the patient towards us. You're going to weight weight transfer forward. And we're going to go on ready, steady, slide. Ready, steady, slide. So as you can see, the patient has nice and smoothly transferred from one side to the other side. We then roll the patient to remove the slide sheet or remove it from underneath the knee as we do